states here in the tri-state, new vaccines are also being tested. And it's really, of course, a race against time, getting shots in the arms as the COVID-19 death toll climbs. Amid the vaccine rollout, state leaders and local health officials alike have expressed frustration about struggles to meet the demand.
But scientists in Cincinnati are working to change that. WCPO 9 News reporter Kristen Swilley shares what they're doing to bring new vaccines online.
Vaccines from AstraZeneca and Johnson & Johnson could get emergency use authorization in the next several weeks. And some of the research being done for AstraZeneca is happening right here at Cincinnati Children's Hospital.
Within a couple months, I think we're going to have plenty of vaccine.
That's because two more companies are fighting to join the ranks of Pfizer and Moderna.
I'm really expecting that AstraZeneca vaccine will have that EUA by the end of this month.
Johnson & Johnson, which only requires one dose, is expected to apply in February. And if they get that emergency use authorization, the shots could give vaccine rollout a much-needed shot in the arm.
Pfizer, Moderna, AstraZeneca, Janssen have all said that by the end of the year, they can each produce about 1 billion doses of vaccine.
Dr. Robert Frank, director of the Vaccine Research Center at Cincinnati Children's Hospital, says there are about 1,000 people enrolled in the vaccine studies, which started in the spring of last year. So far, side effects have been rare and mild.
There's absolutely no evidence that the vaccine is associated with infertility at all. There's also no evidence that the vaccine incorporates in your DNA. That's what people have been worried about, that it changes your genetic material. That does not happen.
He says the bigger battle won't be supply, but demand, as many worry about safety. Frank warns COVID-19 itself remains the far greater threat.
That's why the vaccines are so critical, is because that's the way we're going to break this cycle. That's the way we're going to get back to normal.
Frank says there could be a vaccine licensed for children 12 years and up who usually get mild cases themselves, but could pass the virus on to more at-risk groups. At Cincinnati Children's Hospital, Kristen Swilley, WCPO 9 News.